The thoracic cage. The thoracic cage or rib cage forms the thorax or chest portion of the body. It consists of the 12 pairs of ribs along with the costal cartilages and the sternum. The ribs are anchored posteriorly to the 12 thoracic vertebrae T1 through T12. The thoracic cage protects the heart and lungs. The sternum is the elongated bony structure that anchors the anterior thoracic cage. It consists of 3 parts: the manubrium, the body, and the xiphoid process. The manubrium is the wider superior portion of the sternum. The top of the manubrium has a shallow U-shaped border called the jugular notch or the suprasternal notch. This can be easily felt at the anterior base of the neck between the medial ends of the clavicles. The clavicular notch is the shallow depression located on either side at the superior lateral margins of the manubrium. This is the site of the sternoclavicular joint between the sternum and the clavicle. The first ribs also attach to the manubrium. The elongated central portion of the sternum is the body. The manubrium and body join together at the sternal angle, so called because the junction between these two components is not flat but forms a slight bend. The second rib attaches to the sternum at the sternal angle. Since the first rib is hidden behind the clavicle, the second rib is the highest rib that can be identified using palpation. The sternal angle and second ribs are important landmarks for the identification and counting of the lower ribs. Ribs 3 through 7 attach to the sternal body. The inferior tip of the sternum is called the xiphoid process. This small structure is cartilaginous early in life, but gradually becomes ossified during middle age. Each rib is a curved, flattened bone that contributes to the wall of the thorax. The ribs articulate posteriorly with the T1 through T12 thoracic vertebrae, and most attach anteriorly via their costal cartilages to the sternum. There are 12 pairs of ribs. The ribs are numbered 1 through 12 in accordance with the thoracic vertebrae. The bony ribs do not extend anteriorly completely around to the sternum. Instead, each rib ends at a costal cartilage. These cartilages are made up of hyaline cartilage and can extend for several inches. Most ribs are then attached either directly or indirectly to the sternum via their costal cartilage. The ribs are classified into 3 groups based on their relationship to the sternum. Ribs 1 through 7 are classified as true ribs. The costal cartilage from each of these ribs attaches directly to the sternum. Ribs 8 through 10 are called false ribs. The costal cartilages from these ribs do not attach directly to the sternum. For ribs 8 through 10, the costal cartilages are attached to the cartilage of the next higher rib. Ribs 11 and 12 are also known as floating ribs. These are short ribs that do not attach to the sternum at all. Instead, their small costal cartilages terminate within the musculature of the lateral abdominal wall. Thank you for watching.